Hi friends, this is Dr. Ashwin. This case is called a floating rock. Why? We will discuss about it soon. So if you have noticed, I have made a small side port at 3 o'clock and I went for a main entry in the beginning itself, and this is the side port at 9 o'clock, which is also a small one. Intracameral, mydriatic as well as anesthetic was injected, followed by trypan blue under the air bubble, gave a small massage and got the air bubble out of the anterior chamber with 2% HPMC. A 26 gauge bent needle was used for the capsular access. So with the help of a smaller side port, I could maintain the anterior chamber in such a case. If it was a larger side port, the chances of having our rexis running out would have increased because of the positive pressure that is coming from inside the capsule, as well as because of the leakage of HPMC. With the phaco probe, I am attempting horizontal direct job, but as we can see when I'm trying to hold it, it's floating around. That's why I would like to call this case the floating rock. I'm not at all getting a counter traction when I'm trying to chop the nucleus, but I somehow managed to divide the nucleus into two hemispheres. I'm dividing each hemisphere into smaller pieces and emulsifying it very carefully. So the thing that you have to be really careful by emulsifying in such a case is that the cortex is not at all there to protect your capsule. It is very much liquefied. So going for a piece like this, try to get the hemisphere of nucleus behind that piece so that when you're emulsifying, you have some sort of protection for the posterior capsule. Again, dividing that hemisphere into smaller pieces, I'm very careful with the foot switch and the amount of power I'm putting on each nucleus while emulsifying. The last piece has been emulsified and I'm using IA1 setting for the remaining cortical matter. Maintaining the anterior chamber with viscoelastic. Now I will be extending the side port for the IA probe. A little bit of adherent cortical matter is still remaining, and IA probe is always helpful in removing such cortical matter, especially when it's subincisional. I'm doing a hydroimplantation of the intraocular lens, and I managed to get the intraocular lens in the capsular bag. Remaining viscoelastic has been removed and the case has been completed. Thank you so much.